Good afternoon, I'm Shane Masters with the Midday News. A special welcome if you're watching on onespotmedia.com. Education Minister Faval Williams has announced that only students preparing for examinations should be engaged in face-to-face classes effective today. The announcement was made at a virtual post-cabinet press briefing this morning.
We've indicated that our schools that are open for face-to-face are only allowed to have or exit exam students in the face-to-face mode, and that would be students in grade 6 at the primary schools and students in grades 11, 12, and 13 at the high schools. And in terms of the time frame for this, it's taking effect today until further advised.
The move is part of efforts to limit the spread of COVID-19 in schools that have been utilizing face-to-face classes. More than 400 schools were approved by the ministry to use that mode for delivery of lessons. However, only 300 schools have been engaging in face-to-face classes. Now, according to the Education Minister, 41 schools have reported a positive or suspected case of COVID-19 as at February 21.
Total number of confirmed cases among our student population would be 47, and 6 suspected cases among staff. There would have been 23 confirmed cases and 18 suspected cases.
193 new COVID-19 cases from 1,017 samples. This represents a positivity rate of 18.9%. Their ages range from 9 days to 89 years. Kingston and St. Andrew recorded 42 cases, followed by St. Catherine with 36, while 28 were confirmed in St. Anne. The country's overall case count now stands at 22,019. The Health Ministry says 268 people have been hospitalized with the respiratory illness. Of that number, 20 are critically ill and 35 are moderately ill. Meanwhile, Jamaica recorded 1 new COVID death yesterday, pushing the death toll to 406. The number of active cases stands at 8,292. Health Minister Dr. Christopher Tufton has flatly rejected reports in the New York Times which suggest that Jamaica's COVID-19 outbreak is the second worst in the world. The New York Times, in an interactive feature plotting the spread of COVID-19 globally on Monday, found that the rate of infection in Jamaica had risen by 210% when compared to the last 28 days. Marked against 22 other countries with spiraling cases, the Times report ranked Jamaica second, with only Iraq's 338% increase being worse. In arriving at its list of 23 worst-hit countries, the New York Times said that it calculated the percentage change in cases against the rate from the previous month. The Times list only includes countries that have had outbreaks larger than 10 cases per 100,000 people since October 1, 2020, and have a population of more than 1 million people. Now, taking to social media site Twitter yesterday, Health Minister Dr. Christopher Tufton said to characterize this as the second worst outbreak in the world is misleading, unfair, and incorrect. Dr. Tufton further noted that to get to such a stance, the death and total case rates must be taken into consideration. The minister further noted that in terms of a country's death rate, it is 3.6 per 100,000. He further stated that in terms of a case fatality rate, that is 1.8%, which places Jamaica at 85th out of the 175 countries. This, he says, is below the global average of 2.2%. Inmates in COVID-19 isolation at the South Camp Adult Correctional Center say they are worried for their lives after a fellow inmate died in hospital yesterday. It's understood that the inmate had been complaining about chest pains before being hospitalized about 3 days ago. An inmate at the facility told our news center last evening that the authorities have been ignoring the inmate's complaints for days.
The woman was still burning for her chest, days after days. You know what happened that evening when they take her out here that evening about this time after 6? You know what happened? She sit down in the wheelchair for hours outside of the doorway. before the ambulance came. Yes, and when the ambulance eventually came and they put her in the ambulance, they still take hours before them take her outside of the prison.
Now, it's understood that another inmate who tested positive for COVID-19 was hospitalized yesterday. 43 inmates and 16 staff at the facility have tested positive for the virus. Some of the nation's hospitals continue to face crisis as the battle against the coronavirus continues. TVJ News has learned that some hospitals are experiencing challenges with a dramatic hike in demand for oxygen. But the management of at least one hospital says the supplier has managed to give them enough to keep operations going. Codian Barrett reports.
The demand for oxygen in hospitals and other facilities across the island has ballooned in recent months due to the rise in COVID-19 cases. A COVID-19 patient needs 4 times as much oxygen as a regular patient would, and data show that 15% of COVID-19 patients will need supplemental oxygen. IGL is the island's sole supplier of oxygen. Managing Director Peter Graham confirmed that the demand for oxygen has risen by 25% given current spike in cases. Mr. Graham admitted that some hospitals may run low on supplies occasionally, but those needs are quickly filled. The St. Anne's Bay Hospital is one of those dealing with increased oxygen usage.
It's not a case where we run out when we call it. We don't wait for that. Oxygen is so critical to patient care. We cannot afford to run out. We can't run out. We just simply can't. We can't afford to. So what is happening is when we get to a certain level, we are running back much faster and more often than we normally would to our supplier. And thank God, and thankfully rather, our supplier has been accommodating. We don't get 100% of what we want, but we get more than enough to keep us going.
Mr. Morgan added that oxygen usage has doubled at the St. Anne's Bay Hospital.
Pre-COVID, we used to use about 100 liters per day. We find that we are now using about 200 liters per day in our oxygen. If we used to get a full replenishment of, say, 12,000 liters, we are now not getting that on our refill. We get about 60% of what we normally would order because there's just so much of it to go around. And so we understand that.
Meanwhile, the IGL boss pointed to a global shortage of medical oxygen and credited his company's investment in manufacturing oxygen locally as part of an import substitution policy in 2018. Prior to that, Jamaica imported close to 100% of its oxygen needs. Codian Barrett, TVJ News.
As COVID cases continue to increase rapidly across the island, bed spaces are diminishing. At least 3 hospitals since the start of the week have announced that they are at capacity for COVID-19 patients. Health Minister Dr. Christopher Tufton told a press conference yesterday that the increase in hospitalization is alarming and the health system is struggling to keep up.
Dr. Tufton revealed that with an increase in active cases, there's an added burden on an already overburdened health infrastructure and health teams. He said some hospitals are already at full capacity.
We have currently some 13 of 22 hospitals across the island at the red alert phase, which means that they have a greater than 84% occupancy level for its isolation capacity. 9 of these hospitals are at 100% or greater capacity.
In addition to the construction of field hospitals, arrangements have been made for several hospitals to be provided with more beds.
Totaling some 72 beds. We're adding an additional 20 beds at the National Chest Hospital, and I visited the National Chest Hospital yesterday. Their COVID ward was 100% taken up, 36 beds. They are now adding additional 20 beds, and we're providing for them some additional infrastructure to support that.
In the meantime, the health minister is warning the public that there will be longer wait times.
The reality of the situation now dictates that those who go to our public health institutions at this particular point in time are likely to experience wait, and longer than usual wait. So patience is going to be very important, and I understand the stress and the emotions attached with sickness, But the truth is, with the limited capacity that we have of personnel and sometimes infrastructure, expect to wait beyond the normal wait times.
He's also appealing to persons to not go to hospitals if it's not necessary. For non-emergency cases, he recommends people visit their health center or contact their doctor to prevent clogging the system. Cody-Ann Barrett, TVJ News.
And it's time for a break here on the Midday News. Stay with us. More stories when we return. Welcome back. Continuing the news. The police have not yet determined the motive for yesterday's shooting that resulted in one man being killed and 5 persons injured on the Hanshaw Main Road in Greater Portmore. The dead man has been identified as Winston Jones of a Greater Portmore address. He was reportedly a bystander. The incident happened shortly after 5 p.m. Now reports are that 2 men on a motorcycle rode up to a white station wagon motor car. There was a shootout, and during the exchange, the men on the motorcycle and in the vehicle were hit, as well as bystanders. They were taken to hospital where Mr. Jones was pronounced dead. Traffic had to be diverted because of a massive gridlock following the incident. Commanding Officer for the St. Catherine South Police Division, Senior Superintendent Clive Blair, told our news center that investigators are pursuing leads. The Clandon police say they will not relent in dealing with the rise in criminal activities within the parish. The warning comes from Operations Officer for the division, Superintendent Christopher Williams, following a double murder in the parish last evening. Herman Green has more.
Clandon continues to be a hotbed for criminal activity, but the police are adamant that they will bring the crime situation under control. The assurance follows the shooting death of 30-year-old taxi operator Kurt Taylor and 28-year-old Jamalco employee O'Dane Brown, both of Hayes, Clarendon, Tuesday evening. Residents say they heard loud explosions shortly before 7 o'clock in the vicinity of the Portland Cottage and the Rocky Point crossing, and subsequently alerted the police. On the arrival of the lawmen, both men were found dead in a white Toyota Probox motor car.
Well, we have commenced our investigation. So far, everyone is tight-lipped about what really took place. We are just putting the pieces together now to see how best we can find the culprits who are responsible for this. I don't want to say too much, but what we theorize so far is that there might have been a third person traveling in the unit, based on where the spent casings were found and so on.
Over the last few months, the parish of Clarendon has recorded an uptick in double murders, which the police say is a worrying trend. However, they say no effort will be spared in restoring law and order to the parish.
That's a worrying trend. We are having an uptick in murders in the parish. It's of concern for us. Already we have started to do a more, detailed assessment of what is happening in the parish. We already know that Clarendon have an issue with guns and how people deal with their conflicts and so on. But we are not going to relent. We are going to double our efforts to basically see how we can arrest this challenge.
Herman Green, TVJ News.
The St. Anne Police and the parish court judge are at odds following the sentencing, which saw one of the main criminals in the parish only getting a slap on the wrist for gun-related crimes. More in this report.
There is much disquiet among police officers over a recent sentence handed down by a parish court judge, which saw one of the main culprits of crime in the parish getting a 9-month sentence for gun-related crimes. The criminal has been on the police radar for gun runnings for several years and was finally nabbed last year. Jamar Bartley, otherwise called Tatty, of the Hollywood Gang, operating in Steertown, St. Anne, has eluded several joint police military operations after his involvement in several gun crimes committed in St. Anne and other parishes. He was finally held and charged in June 2020 for illegal possession of firearm and ammunition and has been in custody since. Bartley pleaded guilty to the offense on February 2 and was sentenced to 9 months imprisonment. Now, in consideration for the time he spent behind bars since last year, the parish judge ordered that Bartley serve only an additional 1 month in prison. Although very tight-lipped about the sentence, members have expressed disgust that the full brunt of the law was not given to someone who created so much mayhem and who will be back on the streets shortly. The Firearms Act prescribes a sentence of up to 5 years for illegal possession of a firearm in cases brought before a parish court. However, it was revealed that Bartley has other matters pending in the St. Anne's Circuit Court. Herman Green, TVJ News.
All persons with sickle cell disease who access health care at the University Hospital of the West Indies Sickle Cell Unit are now exempted from paying fees to fill prescriptions at public facilities. Information Minister Faval Williams made the announcement this morning at the post-cabinet news briefing.
This will enable them to have their prescriptions that they would have obtained from the sickle cell unit to have these prescriptions filled at public pharmacies at no cost to them. There are approximately 18,000 persons with sickle cell disease in Jamaica, and 22% or 3,600 of these persons currently seek care from the sickle cell unit at the University Hospital of the West Indies. These persons were not able to access medication that was available free of cost to sicklers who sought care in the public health system.
And here's a preview of what's coming up in this evening's health report.
In the next edition of the Health Report, we'll look at cognitive effects of COVID-19.
There are things that are already showing up, not just with the infection itself, but in terms of with the preventative measures. We see where we have to be in social restriction and isolation, where we have limitations on our freedom of movement, etc. And those things will also play a part in putting a strain on our mental wellness and our resilience. And so it's going to be a very difficult period as we try to overcome the pandemic. And certainly in the aftermath, we're going to have to spend a lot of time focusing on mental health recovery and mental wellness of the population in general.
That's the Health Report this evening in Primetime News. And now for today's healthy living tip. Make a routine for yourself and your family. Check and change troublesome thoughts. Practice good sleep habits and do mindful relaxation.
In sports, green light given. Athletes across the country will now be able to begin qualification for the various national and international track and field meets after the J3As received approval for a series of meets from the government that was on Tuesday. Jordan Ford reports.
As of this weekend, track and field meets will be allowed to resume across the island following approval by the Ministries of Health, Sport and Local Government. The approval, which came on Tuesday, clears the way for the J3As to roll out its qualification series for juniors and seniors across the island with strict COVID-19 protocols in place. J3A's President Garth Gale gave further details.
We will begin with a series of 6 competitions across the length and breadth of the island. St. Elizabeth Technical High School will host sprint events, shot put, long jump, high jump, all classes, discus. Then we will also have competition at Kirkvine Sports Club. We will also have been having competition at the GC Foster College of Physical Education and Sports, Jamaica College, UWI, Calabar, and Excelsior.
Gale also said special arrangements have been made for seniors.
And there will also be on Saturday trials for our senior athletes at the National Stadium, and this will begin from 3 p.m. And might I quickly state that all of these events, no spectators will be permitted.
In the meantime, J3A's Vice President Ian Forbes did concede that junior athletes competing at meets across the island may not be doing so on a level playing field.
Some of those venues will probably have only field events. We want to give the athletes a fair chance and an equal chance of qualification. There must be equity to ensure that our athletes compete for the most part under similar conditions.
Gale says there'll also be a protocol for media practitioners covering the meets. Though seniors will be preparing for the Olympics, this year is also a major competition year for juniors, with the World Under-20 Championships set for Nairobi, Kenya in August. Jordan Fort, TVJ Sports.
And that's the Midday News. I'm Shane Masters. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, good afternoon.